Good morning. We are here today to talk about the 7 steps that we're taking in St. Louis County to reduce the spread of COVID-19 in our community, ranging from restrictions on bars and entertainment venues and other businesses to new requirements for data acquisition and data management in the health department. We hope that our actions here today that we're announcing will reduce the spread of COVID-19 in our community and give our parents an option as much as possible to have a choice of an in-school education some point this fall. The last several months have been tough for everyone. We've lost loved ones, some have lost our livelihoods, and we've all lost our normal way of life altogether. But together we can get back to normal, but we must stand united, work together, and make the difficult but necessary decisions to limit the spread of COVID-19 in our community. Summer may be here, but fall is rapidly approaching, and we've all got our eye on what to expect in the coming school year. So this week, parents are in the process of deciding whether or not they will choose a virtual or an in-classroom option for some schools. And they're all following, like everyone, the rise of COVID-19 infections in our community. And I know they want to have the most recent data available to help them make a decision. So this morning I want to share the information that we have with you and some of the steps we are taking to flatten the curve in St. Louis County and to try to give parents who wish to choose so the option of an in-classroom learning opportunity at some point this fall. Earlier this year when COVID-19 arrived, few of us owned a mask or knew what social distancing was about. Social distancing wasn't even in our vocabulary. But COVID-19 was spreading quickly. At one point, the cases were doubling every 2.5 days. Hospital admissions were rising fast, and we were worried about the capacity of our health systems. This time, we're more accustomed to what we can do in our daily lives, how to protect ourselves and our loved ones and our neighbors. And because of these sacrifices we've all made, the cases aren't rising quite as fast as they were back in April, but they're rising too fast. Our rate is increasing, perhaps not as much as other places, but it is increasing at an alarming rate. Yesterday, our daily report of test results indicated that 523 new people in St. Louis County tested positive for COVID-19. And the rate of hospital admissions were rising much higher than we had hoped that they would be at this point. Young people continue to see an increase in new cases. In the 10 to 19-year-old age group, the rate is increasing more than anywhere. In the 20 to 29-year-old age group, we see more cases than ever. Contact tracing, social media, and common sense tell us that one of our challenges is bars and other late-night venues where social distancing, mask wearing, and other requirements just aren't being followed. It has been a challenge. So we're making some changes starting this week. Because the virus is not spreading at quite the pace that it was back in April, we're going to take a little bit different approach than we did back then. Because of our contact tracing and case investigation army of over 300, we are now able to identify more outbreaks and follow them more closely. By working with our Department of Public Health, hundreds of businesses have voluntarily temporarily closed to protect their employees and their patrons during a COVID-19 outbreak. And because of our work with workers, employees, and businesses, they now have guidelines to help protect them and help limit the spread of the virus. And some sectors, like gyms, have worked extraordinarily hard to implement guidelines, and we have not seen nearly the cases associated with those locations. So today I'm announcing 7 new initiatives to try and interrupt the pace of the COVID-19 spread in our community. First, we know that this virus is easily transmitted at large gatherings. When this pandemic first began, back in March, we started by limiting gatherings. So beginning at 5 p.m. this Friday, we will limit gatherings to no more than 50 people in St. Louis County. We know this will be difficult, we know this will be hard, but together we're going to work through this and everyone is going to have to participate in the sacrifice moving forward. We understand how difficult this will be. All pre-approved plans for gatherings will be contacted by our Department of Public Health to give guidelines and any specific circumstances. Secondly, we will be rolling back occupancy for all businesses similar to where they were in June. We will roll back the occupancy to 25%. It will help us make it easier to maintain social distancing practices, and this as well will begin at 5 p.m. on Friday. Our next couple of things will address that the virus is transmitted in places where people congregate, especially close to one another. So our third announcement today is the Department of Public Health will be closing all bars to late night service. This means that bars will close after 10 p.m. each night, and this again starts this Friday. The late night and early morning hours are the times when we see less mask wearing and less social distancing and crowds that simply aren't complying with our social distancing guidelines. We're worried about outbreaks not just among the patrons, but also among the employees. Fourth, we will be initiating a new graduated process for closing businesses that do not comply with our health rules. If businesses are not playing by the rules, then they should not be open. So the Department of Public Health will be finding new ways to work with businesses to make sure they're following the rules, and for the safety of their workers and their families and their customers will, when necessary, ask them to close. Our fifth change that we're recommending today is that all people who are waiting for the results of a COVID-19 test will quarantine while they're waiting for the results of that test. We know because of the national delay in getting test results that some people in our community don't get a test result for 5 or 7 days or sometimes longer. During that time, they are interacting with others and able to unknowingly infect others and help spread COVID-19 in our community. We hope that employers will work with employees to make sure that individuals waiting on test results are able to safely quarantine until those results are available. We will also be taking action this week to make sure all health providers are reporting their testing results promptly. The Public Health Department has issued a rapid notification order to require reporting of test results to the County Department of Public Health, but that hasn't been happening in all circumstances, especially with some of our urgent care providers. So we'll be following up with them this week. If we can't get those testing results rapidly, then we're not able to quickly contact people who are positive and prevent them from passing COVID on to others. And that's number 6. Finally, this week, I'm asking my Director of Human Services to help us provide safe places for teachers to quarantine. Teachers, whether virtual or in classroom, are always important, but let's face it, this fall they're going to be on the front lines as well. We need to recognize that, and we need to treat them accordingly. Just like many of you have gone out of your way to thank our doctors and our nurses and our grocery workers and our transit drivers, let's thank our teachers as well. And we should convey our gratitude to them accordingly. I'm committing our county government to do whatever we can to help our teachers. We'll have more details about each of these steps later this week. Please know that we're trying to take as many steps as possible to flatten the curve and provide a safe option for our parents later this year to have an in-school, in-classroom setting for their students if they choose that option. But even with these steps, even with that knowledge, it's my recommendation as a parent that parents who can choose a virtual option if it's available. And I know that that virtual option will be difficult for many. My son wants to be back in his class this fall. He's a senior, and he wants to be with his friends. I understand that. A virtual learning setting is not the same. But I know that for some parents, a virtual setting creates challenges. Some parents who have childcare needs and some parents who have kids with special needs. They need that support structure and that predictability for their kids to be able to learn. And given the long-standing disparities in our community, we know that many families have unique challenges. And we need to make sure that the county is stepping forward, and it is, to make sure we bridge those equity gaps as well. So this is not something that I would ask the community to do if it weren't to protect the health and the welfare of the kids and their parents and their neighbors. It's all at stake. St. Louis County is resilient, and we'll get through this as we know how. We'll get through it by working together. So please wear a mask in public and continue to follow our social distancing guidelines. The way we get our kids back into classrooms and get our businesses back to normal is to follow our public health recommendations that we are talking about today. Now, these rollbacks and restrictions just apply to St. Louis County. We know that the virus does not know where it is. When we travel to other parts of the region, we can bring the virus back to our homes in our community. When visitors come to our region and our community from other parts of the region, the virus can travel with them. Statewide or regional restrictions would certainly make St. Louis County safer as well. And I'd be glad to answer any questions.
When it comes to different municipalities, they're saying that they have not yet received their funding that was supposed to be allocated from the federal government to the county to these local municipalities to help with safety equipment and the rest. Do you know about that, where that process stands, and if that has not been allocated, why?
We have reserved $47 million to allocate to the municipalities. We're working with them on a formula to make sure it's an equity-based formula. The original proposal from the municipalities was a per capita formula. So we're working with our team in the County Department of Human Services to come up with an equity-based formula to help support those municipalities. That support is unique. There is almost nowhere in the country where a county is supporting their municipalities, but we want to be able to do that here. We've already given any PPE that was requested and will continue to do so. But what we're talking about is financial support for their public safety budgets, and we want to get there in a way that's equitable, and we'll continue to work with them on a formula. I expect to have that worked out in the coming weeks.
And what happens during that gap, right?
The services are continued to be provided. But we will. We're working with them to help shore up their budgets for their public safety services. But as far as funds for PPE and others, that has been provided at no cost through the county.
And I can tell you, being throughout the county, we've seen people take this very seriously, and we've seen others that haven't, and the proof is in the numbers.
Right.
So what do you want to say? I mean, there's an election season coming up. You're hearing from businesses that are not a fan of these restrictions.
Right.
What would you want to tell them, and what do you want folks to know?
My responsibility in county government is to protect the health and welfare of our kids and our families, and we'll have our eye on that first. We are not dismissive at all about the impact of businesses, and we'll continue to work with them. We need widespread adoption of our social distancing guidelines. We need people wearing a mask everywhere, all the time when they're out in public, and that will have a big impact. This is serious. This will overwhelm our community. This will overwhelm our hospitals. The decisions we're making today will not bend the curve for at least 3 weeks. So the cases in our community will continue to climb at this rate or greater for the next 3 weeks. And 3 weeks from now, after Friday plus 2 weeks or more, which is the 2 weeks is the replication cycle of this virus, we will begin to see the impact of the decisions we're making today. So we know whatever we see today will be, the rate of rise that we see today will be much worse before it gets better. So we have to make these decisions now to keep us from getting in a much worse place, to give us the opportunity or the hope at having our kids back in some sort of normal classroom setting in the fall, and give us the opportunity or hope of not having to take more drastic measures to limit activity and restrictions on our businesses like we did back in March. So this step backwards a little bit to where we were in June, we believe for the next 4 weeks, and we believe we'll only have to do this for 4 weeks, and this will keep us from doing anything drastic later in the year.
Can you explain what enforcement will look like? Does this involve like weekly check-ins on these bars and restaurants, or, you know?
Yeah, that's a good question. Most of our enforcement activity is built on reports. We get a lot of reports from businesses. We start with sending them a warning letter to make sure they understand compliance almost all of them step up right away. And beyond that, I believe we'll be dealing with outliers.
Can you expand, number 5, quarantining for people waiting on test results? Does that start Friday at 5 p.m.?
Well, we would ask people to start. We would ask people to start quarantining now if they are waiting for a test result. But we understand that they have to make accommodations with their family and their work. So whatever that takes to that's you know, a cooperation between an employer and an employee. But we know that between 6 and 8% of people who are asymptomatic and take a test are going to be positive. And if they're taking a test, that means they believe that they could be positive. And it's important to avoid exposure of other people until we have that test result. We hope that our testing capacity in our country will get to the point here very quickly where we can get tests in 24 or 48 hours, which is ideal. And then the impact on individuals will be much less. But this current delay of 5 to 7 days has really damaged our ability to keep the virus at check in our community.
Can you expand on this issue again, people at bars? I know you said that you're seeing it in contact tracing. Have you been able to identify specific outbreaks because people are going to bars and restaurants?
Yeah, and if there's an outbreak in a bar or restaurant, then we work with them, and many of them are temporarily closed. But that's when we get to the outbreak, when we get the test results. But we know that this behavior is dangerous. We know that not wearing a mask, getting in a crowd in a bar at night with loud music and yelling is a high risk environment, and it's high risk activity.
We've seen a lot of viral videos over the weekend from
Right.
city bars as well. How much are you talking with Mayor Cruz?
No, I know. I talked to Mayor Cruzen about this. I know she's very upset, and that she has some actions planned against specific bars that are in gross violation of their public health orders.
And so,
what would you say to the people who say that these measures, these rollbacks and restrictions are meant to be, this is a political question, but meant to be a distraction from the police chief issue and the Doyle accusations?
You know, we have to work to protect people in St. Louis County regardless of whether or not we have an election. I think the data strongly supports the decision we're making today. There are people who want me to continue as county executive. There's people who don't want me to continue as county executive, but I have to do what's right. And in an election environment, especially a week before an election, you know, I'm going to be accused of just about anything anyone can imagine. That's what happens. And people just have to sort through that. But the data for these actions is extraordinarily strong.
the county has not been very transparent when it comes to specific bars, restaurants, manufacturers, anything of the sort where an outbreak is happening. If there's a reason behind that, why is it? And is that something you're moving to change?
So if we think there is a reason for people to know of an outbreak at a specific location for a public health warning, then we do that. We're usually able to contact everyone who is exposed, and as long as we can contact the individuals who are exposed, then we work that way. We do have to respect the privacy of the people who are involved in any sort of public health venture. It's always a compromise between the rights of individuals who are infected and the rights of the community to be protected from them, and that's what these public health orders are about. It's a compromise between individual rights of people to make their own decisions and the impact of a pandemic in a community.
And so the teachers are expected to speak later today, and although parents may want kids to be back in school, these teachers may say the opposite of that. This is their profession. Is there any way, shape, or form that the county plans to step in to protect the teachers?
Well, we're going to do everything we can to protect the teachers because I think that's important. They're frontline workers. We know that many of them, the vast majority of them, are concerned about being in a setting where they don't have the proper equipment, and they have to work. And their school administrators, they have to work with teachers to inspire confidence and make sure that they're protected in the workplace. They can't be back at work if they're not protected and they're not safe. But as these numbers continue to rise, it's my impression that we're headed to all virtual school openings this fall, at least to begin with, until we can get the numbers down some and get back to an option of in-classroom setting. I know many schools have already announced that they're all virtual. Some are still considering a hybrid model. But we also have to be very sensitive to parents who have unique situations, who have kids that are disabled, who don't have good childcare options, and we have to make sure that we're working with them creatively to help those parents, just like we did this spring when schools closed and just like we've been doing over the summer.
Last thing I have for you, if you could talk about the economic component of this, we're seeing unemployment benefits basically drop out from where they are. At the end of this month, we're going to, shut down late night business here. How do you plan on helping support those workers, those business owners here in your community?
Well, we're going to do everything we can to support our businesses, but unemployment benefits are really a state and federal issue. We know that that Congress is currently reviewing and considering, and I expect them to pass an extension of unemployment benefits. We hope that they'll do it quickly. We know that there are political issues there because some want political pressure to keep people from staying home, but we also have to protect the health and welfare of anyone in our community. This is a tragic natural disaster that has affected our community in a way where there's no path forward, where people aren't impacted in a negative way. And we do our best to balance those impacts the best we can, but it's very difficult. And I feel badly for people that are negatively impacted by this. It is tragic. But we also have to make decisions that protect the health and welfare of everyone in our community, all the time trying to manage the impact on our businesses. And that's why I believe that a 4-week rollback of our guidelines partially to where we were in mid-June will have less of an impact than a more significant shutdown than April, but will dramatically slow the spread of the virus in our community. Not for 2 or 3 weeks, but it will slow the spread of our virus in our community. So in mid-August, when we have a better testing environment, we can have a smoother landing and can move forward in a much safer way, in a way that impacts our economy in a much less dramatic way.
And last thing, if you can speak to housing as well, that's another issue that's going to be coming up for many folks at the end of the month.
Well, the St. Louis County has designated $10 million for rental assistance and assistance for low and moderate income mortgage support. In addition, we have committed several $1 million to utility relief, and I expect us to revisit that in the coming months as well. This is a very difficult time. It's tragic for many families, and we're going to work together again, focusing the resources of St. Louis County on the families and the places who need it the most, and try and support them through many pieces of this pandemic. This crisis is not just a public health crisis, it's a humanitarian crisis and an economic crisis as well.
We do know our numbers are obviously what we're seeing today is going to be affected by what was actually happening 2 weeks ago. Before we hit 4 weeks, do you anticipate, what's the likelihood that we could see even more restrictions if these numbers just continue to climb over the next 4 weeks?
I think we've picked the right restrictions that will give us a smoother transition through the next 4 weeks. The masking requirement has helped us some, but not enough. We don't have enough widespread adoption of masking. We have a lot of intermingling of St. Louis County residents with parts of our region that don't have widespread masking, and that holds us back some. But we believe that rolling this back partially, back to where we were in June, not to where we were in March or April, which was much more dramatic. That gives us a smoother transition, a smoother balance through the next 4 weeks to try and get this curve, growth curve of the virus in check and get us a smoother path forward. But at this rate, we will overwhelm our hospitals very quickly if we don't do something differently.
Where are the hospitals compared to right now, compared to April? How do they compare?
We have reached the threshold that when we reopened, we said that when we got to 40 admissions a day on a rolling average, that we would talk about doing some different things. And we had hit that over the weekend. So the pandemic task force is watching those numbers pretty closely. We know that 40 admissions per day on average is a milestone and a marker that we decided several weeks ago that we would look at doing something differently. And we know that that number will continue to rise over the next 3 weeks, and the decisions we're making today won't bend that curve. It takes at least one replication cycle of the virus to have an impact. That number is going up.
Could you just clarify one thing? So I've noticed that some areas, they say, like, let's say you test positive for coronavirus. They used to test again to see if that person is still testing for coronavirus positively. Is that still standard practice, or are they saying after you quarantine for your 14 days, you're allowed to return back to work?
I believe that it depends on it depends on what line of work you're in. They may have different settings in a high-risk environment like a hospital, but I believe 14 days after your symptoms are over, you're ready to go back to work. We have to recognize, though, that COVID-19 is not innocuous. People do not just get over it and they're back to normal. You know, a third of people who have been affected are not better in 3 weeks, and including 20% of young people who are infected with COVID-19 are not back to normal in 3 weeks. They just still have residual effects, either peripheral neuropathies or lung issues or shortness of breath. This is not an innocuous illness that when you're through it, everything's good in a few days. Some people get through it and everything's fine in a week or two, but many people do not. We do not completely understand this virus, and we have to respect it.
But there's no county mandate on this is how we proceed once somebody had tested positive.
The current protocol is 14 days after your symptoms. Yeah, and we'll follow up with our press person, but that's my understanding.
What did the CDC though, didn't they just bump it down to 10 for something? Like after you test? There's something new came out Friday, they said
Right.
10 days.
Yeah, there's some new guidelines. I haven't reviewed those. In fact, some people were following the 10-day guidelines before because some people felt that was safe. And for specific circumstances, over the past couple of weeks, after communication with pediatricians or other doctors, the health department was releasing some people after 10 days, depending on their specific circumstances, which I believe related to the severity of their illness. The CDC has issued some new guidelines in the past 48 or 72 hours.
What are you going to do when there's a protest?
What do you mean?
What's going to happen if there's a gathering of Black Lives Matter protesters or whoever else on the street?
Well,
What are you gonna do?
everyone should have masks, whether they're protesting or not. You should have masks, whether you're protesting, you should have masks when you're out in public, you should have masks. We have a mask mandate in St. Louis County, and if there's a protest, it's been my experience over the past few weeks that protesters have adopted masks. Early on, protesters were like many people in our community, and they were hit or miss with masks. But more recently, we haven't seen any protests in several weeks or a few weeks, but more recently we've seen them with masks.
Are you going to limit that kind of gathering? You're limiting other gatherings.
Well, we'll talk about that. We'll take them in a case-by-case situation. Absolutely.
Right now in St. Louis County, you can't even get a cup of ice. And you can't get a roller dog that people want. You can't gather the way people want to gather. You've got a mask mandate, and you're here. Is it safe to say that everything you've done so far up to now hasn't worked?
This is frustrating for everyone, and I get that. It's frustrating that we're still in a pandemic. It's frustrating that our lives are disrupted, and we recognize that, and we're not dismissive of it. All of the decisions we've made are at the advice of public health experts, advice of the medical community, advice of the pandemic task force, and they're certainly frustrating, and I understand that, and I appreciate it, and I'm sensitive to it.
But on what basis did you make those decisions? For instance, let's just say the cup of ice that you can't get at the 7-Eleven. What was the science behind that, and why did you do it?
I'm following the advice of our public health officials, our medical community, and best practices for managing any opportunity to spread COVID in our community. And people who are experts in those sort of things have decided that hard surfaces and contacts such as that have risk to it. And so they've recommended some guidelines, and I'm supporting those guidelines. I will support the guidelines that are recommended by our public health experts, our medical community, and the pandemic task force.
Where did the hard surface science come from again? Because the last understanding was that a hard surface, that COVID did not survive on a hard surface.
I will refer you to our health department, and you can talk to them about the guidelines, but I'm not prepared to debate into the details of any specific guideline. But I will follow their recommendations, I will follow their public health guidelines, and I would ask everyone in the community.
St. Louis County judged the danger of hard surfaces in St. Louis County compared to St. Charles County, which apparently doesn't have a hard surface COVID-19 problem.
Our guidelines are different in St. Louis County than the other region. Other counties, other jurisdictions have made many different decisions on their practices, on their guidelines, and I would refer you to them as why they made the choices that they did. But we make the choices here in St. Louis County based on the recommendations of our public health experts, our doctors, and our pandemic task force.
Hey, Dr. Page, a couple things. The clarification on the asymptomatic folks, that's a recommendation,
Yes.
not a mandate.
Yes, we aren't prepared to mandate that, but we would ask people to follow that recommendation. It will keep them safe, it will keep their family members safe, and it will keep the people they work with safe.
Another question is, why not do this in tandem with other governments?
Well, you know, we have 1 million people in St. Louis County. We're the largest jurisdiction on the Missouri side of the river in the metropolitan service area, and our responsibility is to take care of the health and welfare of people in St. Louis County. I can't speak for the other jurisdictions. They have different demographics, different concerns, and you know, different perspectives.
Do you think the county is communicating this well enough with our young people? We talked about the bars closing, and we've seen these viral videos.
Well-
How do we do a better job of that?
Well, young people are risk takers, and that's the challenge. The challenge is not having an appreciation for where we are, and we see the viral videos, we see the decisions they're making, and it's unfortunate because they do get sick, they do end up in the hospital, they can lose their lives, and they can have long-term effects, and they can certainly spread COVID-19 to their parents or grandparents.
So we have the mask mandate, but you said, you know, it's not widespread enough. What is the county doing to get that message out there? Are you guys doing stops handing out these masks, or what are you?
We've given out 2 million masks in St. Louis County, and we will continue to do so. And we're working with all of our regional partners to get the word out as best as we can. And our businesses, our community groups, churches, other institutions and organizations are all working hard to get the word out about the importance of wearing a mask.
That's all I have. Anybody else? Thank you.
Okay, thanks a lot.